R-Series supports two electrode configurations for pacing. The one-step pacing configuration, or hands-free therapy electrodes configuration with separate ECG electrodes. When the R-Series is used with the one-step complete or one-step pacing electrodes for pacing, a separate ECG cable is not required because the three leads are built into the front electrode pad. Confirm that the red end of the one-step pacing cable is connected to the red one-step cable input, and confirm that the black end of the ECG cable is connected to the black input in the rear of the R-Series. If these one-step electrodes previously mentioned are not used to pace, alternative multifunction electrodes and an ECG cable must be attached to the R-Series. If using a three-lead set, connect the end of the three-lead set to a one-step pacing cable and connect the therapy electrodes to the one-step pacing cable. Confirm that the red end of the one-step cable is connected to the red one-step cable input, and confirm that the black end of the ECG cable is connected to the black input in the rear of the R-Series. If using a separate 3 or 5 lead cable, you must attach the set to the black ECG cable input in the rear of the R-Series. Pediatric patients using the one-step pediatric CPR or PediPads 2 require the use of a separate ECG cable, as these electrodes do not include the built-in 3-lead capabilities. Non-invasive pacing of pediatric patients is performed in an identical manner to adult pacing. To begin pacing your patient, turn the dial to Pacer. The downward spikes indicate pacing pulses. The rate will default to 70 pulses per minute unless your institution has configured it otherwise. For one-step pacing, the ECG signal appears in lead P2. It is important to note that while ECG signals acquired from P1, P2, or P3 are appropriate to determine electrical capture during pacing, they should not be used for diagnostic purposes. Use conventional ECG electrodes and a separate ECG cable for that purpose. Increase the output by turning the dial clockwise. Normal range for capture is between 40 and 80 milliamps. The minimum output that obtains capture is the patient's threshold. Once you have determined the pacing threshold, set the output to 10% above that threshold. Confirm electrical capture by viewing a downward pacing spike followed immediately by a widened QRS and an extended, sometimes enlarged, T-wave occurring at the selected pacing rate. The intrinsic rhythm should be absent. Mechanical capture can be confirmed by physically palpating a femoral artery, right brachial or right radial artery for a pulse. At any time during pacing, you can use the 4-to-1 button to determine the patient's underlying rhythm. Press and hold the 4-to-1 button. This suppresses 3 of 4 pacer impulses to visualize the underlying rhythm without losing capture. For pacing times in excess of 2 hours, Zoll recommends using ProPads with liquid gel.